You probably wouldn't shout it across the gym. You wouldn't drop it into a work conversation. You might not even whisper it to your closest friend over a late-night coffee. But it's been there, quietly nagging at you for years, maybe decades. That unspoken question, am I normal? I'm Dr. Masha, and today we're diving into one of the most common, yet least talked about questions in men's health. Penis size. We're going to cut through the myths, the locker room legends, and the late-night internet rabbit holes. We'll separate science from fantasy, truth from insecurity, so you can finally stop carrying a weight that was never yours to carry. Because for millions of men, this isn't just trivia. It's a private source of stress that erodes confidence, affects intimacy, and quietly chips away at self-worth. But first, please like the video. The more people like it, the more YouTube will distribute it to people who don't have access to doctors or hospitals. Also, please share the video with your friends and family. Many lives can be saved with your help, so share it. Here's the truth. According to a massive global study of over 15,000 men published in the British Journal of Urology International, more than 90% of men fall into a completely normal size range. So why do so many still believe they're lacking? It starts early. Picture this. You're 13 or 14, scrolling late at night, and you stumble across your first adult video. You don't realize you're watching a performance. Carefully selected actors, chosen for shock value, lit like a movie set, and sometimes even digitally enhanced. But your young brain takes it as fact. That image burns in and becomes your reference point. Add to that the exaggerated chatter in locker rooms, crude jokes, and one-up stories, and suddenly a totally average body starts to feel like it's not enough. Studies show up to 60% of men feel some level of dissatisfaction with their size, even though more than 95% fall within the medically normal range. And when women are surveyed, only about 5 to 10% say size is a major factor in choosing a partner. So where does this obsession really come from? Simple, because no one ever told you the truth. Not in school, not in health class, and definitely not online. Instead, we were handed myths, false comparisons, and a whole lot of silence. So let's fix that, starting right now. What's the actual average penis size? And just as important, how do you measure it correctly? Here's the twist. Most men measure wrong. Think of it like using a bathroom scale that's been broken for years. You'll never get the truth no matter how many times you step on. Some press the tape measure too far forward. Some start at the skin instead of the pubic bone. Some measure from underneath, adding extra length that doesn't reflect reality. Others don't measure fully erect, stretch too little, or compare themselves when cold, stressed, or barely aroused. In medical research, we use a method called the flaccid stretched length, and it's incredibly accurate. Here's how you do it. Stand upright, use a ruler or soft measuring tape, and place it on top of the penis. Start at the pubic bone, pressing gently into the fat pad for accuracy. While flaccid, stretch the penis forward to its full natural length, firmly but not forcefully. Measure from base to tip. That's your flaccid stretched length, and it closely reflects your true erect length. For girth, also called circumference, use a soft measuring tape or even a piece of string. Wrap it around the thickest part of the shaft, mark the point where it overlaps, and then measure that length. Now that you know how to measure correctly, here's what the real data says. A landmark 2015 study, the largest of its kind, looked at nearly 15,000 men across the globe. The average erect length, 13.2 centimeters, just over 5 inches. The average erect girth, 11.5 centimeters, about 4.5 inches around. Not 8 inches, not 10, not what you saw on that late night video, just over 5 inches long. And remember, that's the global average. Even more important, 90 to 95% of men fall between 10 and 16 centimeters. That's roughly 4 to 6.3 inches. If you're anywhere in that range, you are not below average. You're not lacking. You're, by every medical and scientific standard, completely normal. Now, let's talk about the far ends of the spectrum. On one side, there's the medical definition of a micropenis, less than 7.5 centimeters, or about 3 inches when stretched or erect. On the other extreme, there's the macropenis, anything over 24 centimeters, or 9.5 inches. These are extremely rare genetic outliers, not measures of manhood, and certainly not goals to chase. Most men don't fall anywhere near those numbers. They just think they do because they're comparing themselves to fantasy. Adult film actors aren't your average neighbor. They're handpicked for one exaggerated trait. And even then, the illusion is boosted with camera tricks, flattering lighting, silicone prosthetics, and yes, sometimes even digital enlargement. A 2016 investigation by Men's Health magazine found that in some adult scenes, size was literally extended in post-production. What you see isn't just exaggerated, it's engineered. But your brain doesn't process the edits, it just processes bigger. And deep down, that can plant the idea that you're somehow smaller. It gets worse. Many men size themselves up in the most unflattering conditions possible. They glance in the bathroom mirror while flaccid, in a cold room, or under stress. The penis is incredibly sensitive to temperature, anxiety, and blood flow. A little chill or tension can shrink it by half. Now compare that to someone on screen, fully aroused, under perfect lighting, with digital enhancement, and the comparison isn't just unfair. It's absurd, but that absurdity can snowball into insecurity. Insecurity can turn into anxiety, and anxiety that seeps into relationships, drains confidence, and chips away at self-esteem. And here's the kicker. None of this is based in biology. It's not science. It's distortion. A study from UCLA's Department of Urology found that most men seeking enhancement surgery already had normal size, and yet, after the procedure, 40% were still dissatisfied. Many of these surgeries come with real risks, especially when they're not medically necessary. And beyond a certain point, around 6 to 12 inches, more size doesn't mean more pleasure. In fact, it can actually cause discomfort for a partner. So, what actually works? Let's talk about real, safe, effective tools to improve how you look, feel, and perform. Tool number 1, reduce fat around the pubic area. As belly fat builds, the penis looks shorter, not because it's actually shrinking, but because it's buried in the fat pad. Studies show that losing just 2 inches off your waist can add up to 1.5 centimeters in visible length. Tool number 2, improve blood flow. Your penis is a vascular organ, not a muscle. More blood means more fullness. Eat nitrate-rich foods like beets, spinach, and arugula. Consider L-citrulline or L-arginine under medical guidance. Stay hydrated. Quit smoking. And yes, do pelvic floor exercises. Kegels aren't just for women. They strengthen the muscles that control blood flow, rigidity, and stamina. Tool number 3, check your hormones. Testosterone is your body's fuel. It drives mood, libido, circulation, and vitality. When levels drop, nighttime erections can decrease, tissue can become less responsive, and both performance and appearance can change. Ask your doctor for a full hormone panel. Test total testosterone, free testosterone, SHBG, and estradiol. If your numbers are low, start with natural fixes. Better sleep, heavy strength training, more zinc, less alcohol. If that's not enough, discuss medically supervised options. Tool number 4, Stop comparing, start connecting. You are not a number, not a measurement, not a ruler against a screen. Satisfaction for a partner isn't about length. It's about connection, confidence, and presence. Tool number 5. Seek real guidance. If you're considering enhancement, pause and ask yourself, am I doing this because something's truly broken or because I was never taught the truth? If the answer is emotional, talk to a therapist before you talk to a clinic. Body dysmorphia is real, and making permanent changes without fixing the root cause can leave scars you can't see in the mirror. The truth? You may already have exactly what you've been chasing all along: normality. The majority of men fall well within the normal range, and that's not a consolation prize, that's reality. So here's the takeaway: you are not your measurement, you are your mindset. Power comes not from changing your body, but from understanding it, respecting it, and optimizing it. When you stop obsessing over size, you free yourself to focus on health. And when you do that, everything improves: performance, confidence, relationships. So ask yourself, what's more powerful? Being above average on a ruler, or being in control of your body, your mind, and your life? You already know the answer. Now do one more thing. Leave a question in the comments. We answer them anonymously. Subscribe for more truth and less noise. And if this helped you, share it, because you never know which friend is silently carrying the same question. You were never too small. You were just never told the truth.